Hi, it's Dr. Steve Steele again. Today I'd like to look at ethical considerations in applied sociology. Now, ethical concerns are a big issue always, but in the 21st century they've even become more important. Why? Well, the rate of change really has challenged just what are the guidelines for dealing with, researching, knowing other people in general, and then specifically, how do you do it when you're trying to apply a science? The rules for interaction have vastly changed since the internet, YouTube, Facebook, and a variety of other interacting systems have made it possible for us to watch and know a number of people. What are the basic guidelines then for doing this? I mean, what are the basic ethical baselines? Now, in this particular video, I'm not going to be able to look at the entire waterfront with regard to this. You'll probably need to go to the American Sociological Association's webpage and take a look at their ethical guidelines to really be thoroughly versed on this. Same thing could be said for looking at the Association for Applied and Clinical Sociology website. Both of those will give us some insight as to a more extensive view of ethical behavior when you're trying to apply sociology to a situation. But let me just focus on two basic ethical guidelines, or if you will, codes of behavior. First of all, sociologists and applied sociologists particularly, in an applied setting, don't want to lie about the results. Now, this is kind of an interesting issue because, as we'll see, the challenges of applied sociology are sometimes quite different than those of basic or theoretical sociology. And the second thing, and this is sometimes hard to do because it's sometimes not intended, but it pops up, you don't want to hurt anybody in the process of applying sociology to a social situation. Let's take a minute to look at the difference between applied and basic sociology and then the differing ethics. As you'll remember, basic sociology is theory construction and trying to do the best you can in creating a good theory that explains social situations. And applied is using those theories and tools to try to improve a situation or as you might guess, make it more effective or trying to improve the quality of life for the people in it. How do the ethics differ there? Well, let's take a look at basic research. Very often in basic research, there's a controlled situation. There are things around us, like IRB, institutional research boards, that help us understand just what are the guidelines for putting human subjects in a situation for which we can research. Just for example, an IRB would probably not let you do an investigation of people who are institutionalized. By definition, these are people who are vulnerable, and putting those kinds of people in a vulnerable situation, well, hey, it might be a problem. I don't want to do that. And so in basic research, we're trying to manipulate, if you will, the independent variable, okay? We're trying to manipulate the causes to see what effects occur so that we can produce a better theory. Now, you might say, well, hey, I want to do practice, I don't want to do theory. Well, just remember, good theories produce good practice. If you don't have a general baseline of how things work, you're going to have a hard time trying to apply it. So in the situation with regard to ethical concerns and codes of behavior, first of all, we don't want to harm anybody, but if you're in a basic social situation, a basic research situation, you don't get to actually do it unless you can demonstrate right up front that you're not going to harm anybody. And your purpose ultimately is not necessarily to solve a real-life social problem, but rather to deal with a theoretical problem, to better understand a theory. And There are guidelines. Certainly, you can't, you don't want to harm people there as well. You neither want to harm people nor do you want to lie about your results. There are guidelines for this. And, also, of course, you can't plagiarize somebody else's work, which is kind of like lying. You have to do original contributions to research to improve the quality of research and to try to emphasize and improve the theoretical backgrounds for the discipline. But what about an applied setting? Very often applied sociology and applied research in general, across all sciences, be it physics, chemistry, economics, whatever, often is done for a client. There is someone who needs to know something to improve his or her situation. This might be a hospital, for example, that wants to know how best to structure an emergency room. After all, every individual who comes in an emergency room has his or her own malady. But the big question is, how can we generally, perhaps, and more efficiently treat people who come through the doors? Are there process problems? Are there structural problems, the way things are organized? And can we improve on those? Well, clients will ask those questions, and they're important questions. And an applied sociologist, a clinical sociologist, a public sociologist, a sociological practitioner, that is, can answer those questions, or at least help answer them for an individual or a client. The problem, of course, arises that there are a couple of things that we have to consider. First of all, are the clients ethical? And they may not really care about hurting people. Certainly in the example I gave, in a hospital, you wouldn't expect that. Most of the time, hospitals are in place so that they can help people. But on the same token, what about triaging people in an emergency room? In other words, who goes first, who goes second, who goes third? We might be able to help them understand this, but are we ethically bound to simply report this, or do we worry about whether or not certain clients might approve some patients versus others? Well, it might be a consideration that we're worried about. Might be an issue. Don't know. In addition, we can look at things like look at businesses who simply want to know, well, okay, how can I more effectively market my product? Good question. Okay. And it produces debate in the sociological community about whether applied sociology should be used at all to help market products. My personal notion on this is that applied sociology is valuable stuff and can be used that way. But you do have to ask a couple of things. First of all, if you're looking at harm in an applied sociological way, who, if any, persons are you harming? Are they at a micro level? Okay, you want to say yes or no. In other words, are individuals being hurt? Or if you're looking at a meso level, an organizational level, and you do research on the organization, if you change the organization, will individuals be hurt as a result of your research? And last but not least, if you're doing a macro view and you're perhaps trying to recommend policy, at what level will people be affected and how will they be hurt if they implement your applied recommendations? The issue here is that whereas basic work in and of itself may not have direct applications to human life, but the caveat there is that of course if you use those theories somewhere else, they will have an implication for other people. But where I'm going with this is you very likely through your applied work will have some impact, perhaps direct, on human lives. Your question is, what, if any, damage might occur as a result of your research? You don't want to hurt anybody if you can help it. Now, on the other side, it's almost impossible to do any sort of applied research without influencing someone. I mean, that's the idea, basically. That's why a hospital would want you to help them organize their emergency room. They do want to affect people. They do want to have some impact on treating people the most efficient way as possible, perhaps, or producing some level of quality in what they do, or finding out if people are having a good experience in their emergency room. So as a result, you probably can't avoid having an impact on other people when you do your research. So it's important to see the value and the importance of ethics in this. It's important to question your own personal ethics. Am I willing to work for this company or not? Do they have a good ethical track record? And then to also thinking about the actual client's ethical needs and the client's ethical guidelines. Do you fit in those? Can you work within those? Are those things that you can actually subscribe to? Be real careful and be real thoughtful about thinking about these issues. And then, what are some of the practical applications of ethically perplexing issues? There are many, and I certainly can't cover them all here in this video, but think about a couple of things. And these are experiences that I think many applied sociologists have had. Sometimes there are unintended consequences of the things that you do. Applying your sociology perhaps at a meso level, at an organizational level, may have some unexpected consequences at a micro level. These are things that you didn't intend to happen, but might happen. Or you hadn't thought about what would happen next after the implementation of a change that you might recommend. It's important and consequently you may very well argue, hey, I didn't knowingly do anything ethically wrong. I simply was trying to make the organization more effective. This is something you need to consider because, and as we see with sociologists who are engaged in making national and international policy, there's a concern that perhaps you have to be considerate of the issue of what happens when macro level policy changes influence people and organizations below that level. What will be its outcome? So, who are you working for and what are their ethics? And what are your ethical considerations and constraints? And finally, what are the guidelines that are proposed by professional organizations? If you're going to be an applied sociologist, I recommend that you go to the American Sociological website and take a look at their ethical guidelines. If you're going to be a sociologist in your life, it's wise for you to print those out, to read them, and try to hold to those ethical that ethical set of codes and thoughts. And the reason I suggest that is, in the absence of any ethical help from other people, those guidelines can be really useful to you. So I just want to make it clear that, hey, this particular video is hardly the end-all with ethical issues, but I just wanted to make you aware that there are ethical concerns when you start working with human beings in either your research or your applied work. Take care and have a good day.